views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hi, and welcome to Open Tuesday, a weekly program providing you the latest information, resources, services, and community efforts taking place locally here in the Bronx and virtually. I'm your host, Sonyi Lopez, and today is Tuesday, April 13th. Coming up, we'll discuss the passing of two historical pieces of legislation, the Marijuana Regulation and Taxation Act and the Halt Solitary Confinement Act with Assemblymember Kenny Burgos. Then we'll talk to a Montefiore doctor about rising pandemic-related depression, anxiety, and substance use disorders, and how Montefiore's Behavioral Distinction recipient, the Behavioral Health Integration Program, or BHIP, is here to support. After that, the New York Public Library in Wakefield is holding a series of online events, including one about the 2021 Summer Youth Employment Program. Stay tuned to learn more. And St. Anne's Corner of Harm Reduction joins us to discuss the opioid crisis during COVID-19, as well as share outreach and services available for people in the Bronx. So please stick around. Open Tuesday starts now. Welcome to Open on BronxNet. I'm your host, Sonyi Lopez, inviting you to follow us on social media at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. The U.S. state of New York recently enacted two groundbreaking pieces of legislation. One law limits the practice of solitary confinement, and the other legalizes marijuana. One assembly member from the Bronx shared some comments in Albany after voting for the MRTA marijuana law. Let's check this clip out.
That's what we're voting on today. Equity. Economic and social equity for all New Yorkers. So regardless of what you call it, marijuana, cannabis, weed, pot, bud, grass, dank, sour, kush, chronic, ganja, reefer, haze, or zaza, I could go on all day. But regardless of what you call it, after today, we'll call it legal.
I thought that speech was really iconic. So joining us now to discuss is Assembly Member of Assembly District 85, Kenny Burgos. Welcome, Assemblyman Burgos. As we say in the Bronx, that was mad funny. Zaza, let's shout out to CJ. Thank you so much for joining us today.
Thank you for having me, Sonyi. Yes, shout out to CJ. Although he's from Staten Island, I'm going to say the Bronx has adopted the term Zaza and has made it our own.
We definitely have, and we'll take him in. Welcome to the Bronx, CJ. We'll take you in.
We'll take it.
On to the serious stuff. So now about this Marijuana Regulation and Taxation Act, aka the MRTA, can you tell us more about it?
Yeah, so the MRTA is essentially, it's a historic bill the legislature passed. This is legalizing adult use recreational marijuana for adults to age over 21, and it really just aims to end the decades-long prohibition of marijuana that we've had in New York. This also aims to create a new office of cannabis management. This is to be the regulation of cultivating, growing, sales, and distribution of marijuana. The bill also works to get the framework for tax structure so we can bring in significant revenue here in New York to really aim towards our most needed social services. And then I think at the heart of it, the bill is just to address racial and economic justice that our communities have just been impacted for decades with the prohibition of marijuana. So that's the main focus of this bill.
Right. Thank you so much for breaking them down, Assembly Member. And I'm glad you bring that up because for far too long, the Bronx has been disproportionately affected by the criminalization of marijuana. Can you break down how exactly this bill seeks to support the community through reinvestment and equity?
Yeah. So, I mean, we know New York's existing marijuana policies before this bill have just really failed to protect the welfare of our communities. These policies have put thousands of New Yorkers into the criminal justice system for really nonviolent offenses and really denies people the fundamental right to vote, access to housing, student loans, and just a ton of vital services to be just working members of our community. So in the past 2 decades, New York has become really the marijuana arrest capital of the country. Over 800,000 arrests and summonses dealing with marijuana. But unfortunately, that has been completely disproportionate, especially when you talk about communities like the Bronx. In New York City, African Americans are arrested for low-level marijuana offenses at 8 times the rate of their white counterparts. Hispanic and Latino communities are arrested 5 times the rate of their white counterparts. And now we know just through our own, life and also statistically that Americans use marijuana at pretty much the same rate. So it's proven that these policies have just unfortunately targeted our communities here in the Bronx. So this bill is really just aiming to reverse these kinds of policies and prepare the communities with the tax revenue that we collect.
Good to hear. And how else is cannabis tax revenue being distributed through the tax exactly?
So the Marijuana Regulation and Taxation Act is aimed it's estimated to collect about $350 million a year, and I think probably on the lowest end. You have some estimates that bring it at about $500 million to almost $1 billion a year in terms of tax revenue. So all the revenue raised from marijuana sales would go into a dedicated cannabis revenue fund, and this would be targeted to cover training for law enforcement to detect drivers that are high. It has 20% dedication to treatment and public education, 40% to the state lottery fund for public education, and 40% to a fund that makes grants for social equity, including job placement programs. So we were very, very strategic in crafting this bill to make sure the revenue we collect is highly targeted and highly purposeful.
Okay. And in simple terms, people may be wondering, tuning into the show, does the MRTA essentially mean that Bronxites can smoke and carry marijuana without fear of being arrested?
Simply put, yes. Marijuana is now currently legal in New York State, although the regulation framework and you won't see dispensary sales for about 18 months or so. Right now, it is illegal to possess up to 3 ounces of marijuana, and you're able to smoke marijuana, although there are still just simple regulations similar to smoking or drinking alcohol, correct, right? So where you can't smoke cigarettes in public spaces, in a bar or restaurant, on planes, things like that, you cannot smoke marijuana in those places either. Comfort of your home is obviously safe, assuming your landlord doesn't have a no smoking policy. And obviously, it is still illegal to drive while impaired, which would mean driving while high.
Thank you for breaking that down as well. Assemblymember Burgos, you and your colleagues also recently voted on a now passed historical law ending solitary confinement. It's called the #Halt Solitary Law. Can you tell us more about this law?
Yeah, this was an absolutely huge bill. Advocates have been fighting for this for so many years. It's been held up because we've had a Republican state Senate. But thankfully, we've reached a point where there's been support, we got the votes, and we were able to pass this legislation. So HALT actually stands for the Humane Alternatives to Long-Term Solitary Confinement Act. And this bill really just limits the time an inmate can spend in segregated confinement. So this ends the segregated confinement of vulnerable people, restrict the criteria that can result in this kind of confinement, and just create a more humane and effective alternative to these kinds of confinements.
And when we talk about that, we think about tragedies of Bronxites and Rikers, specifically Kalief Browder and Layleen Polanco, among many others. Solitary played a huge role in their deaths. How would this law seek to rectify current long-held inhumane practices on Rikers Island in particular?
Yeah, those were horrible tragedies that we heard of our neighbors, right? When you talk about Layleen Polanco, who lost her life in solitary confinement on Rikers Island. We talk about Kalief Browder, who unfortunately took his life after spending months and almost years in solitary confinement. It really speaks to the torturous conditions that solitary confinement is. These are conditions that we wouldn't subject our pets to. And we do this to our neighbors, to our brothers and sisters. People who are involved in the criminal justice system who should be seeking rehabilitation and not a punitive structure. So the HALT solitary confinement bill it puts a 15-day restriction on an individual, on how long an individual can be in solitary confinement, but it also has a special population carve-out that are not allowed to be in solitary confinement at all. And those carve-outs are individuals aged under 21, which would have addressed Kalief Browder, unfortunately, individuals aged over 55, individuals with a disability, and any individual who's pregnant or up to 8 weeks postpartum or caring for children in a facility. So we're really just honing in. I would have loved to see, the outright abolishment of solitary confinement, but we're working towards a framework where our prisons and jails really just are rehabilitative and not punitive.
Can you also tell us about the solutions set in place in the Halt solitary law, like the residential rehabilitation units to provide incarcerated individuals with therapeutic and trauma-informed programming?
Yes, so like I said, we're aiming to make these systems more rehabilitative and just not punitive. And do we want systems where people are in this endless cycle of criminal justice, or we want them rehabilitated and make them active members of our community? So things like the RRUs really aim to do that, right? So we mandate there's additional out-of-cell time for individuals that are put into these rehabilitative units after the 15-day limit has been reached. We prohibit denial of services, treatment, basic needs like clothing, food, bedding, where an individual is held in segregated confinement. And we also require the Department of Corrections to publish monthly reports on its website with semi-annual and annual reports of the total number of people who are in these segregated confinements.
Got it. And what are your hopes for your constituents and Bronxites as a whole with the passing of these two historical laws, Assemblymember?
Yeah, I mean, my hope being here as an elected member, for the Bronx and as we work in the state legislature is really to restore justice to our communities. It's not lost on us that there's been decades of prohibition, there's been decades of targeting to communities like ours. So it's really our duty and our job to reimagine how we frame our society, how we establish these laws, and who are they helping, who are they hurting, and to make for a more just, more equitable, and just a more fair system for everyone to live in.
Right. Finally, before we go, how can people stay in touch with you and your office?
Yeah, you can follow me on Twitter, on Instagram, on Facebook. They're all under @Kenny Burgos NY, which you can see on your screen. My office is located in Manor Avenue, 1163 in the Soundview area, and you can call my office at 718-893-0202.
Thank you so much for joining us today and share more on these two historical laws, Assemblymember Burgos.
Thanks so much, Sonyi.
Kenny Burgos is the Assembly member of Assembly District 85 here in the Bronx. We'll be right back here on Open Tuesday.
We know that people are dealing with the health crisis, but there's also a lot of food insecurity.
We're giving out healthy food options, and that's what's key here.
If you're a senior, you have a disability, they'll actually deliver meals to you.
The residents are anxious, they're worried, they're scared, they want to be tested.
When things were happening in our community and we couldn't get the help.
There's almost a presumption of criminality that attaches to your skin color.
The site will prioritize those who are at highest risk in the population.
If you feel symptoms and you'd like to visit one of these COVID-19 testing sites here in the Bronx, you may call the State Health Department's hotline.
Important to note about this site is no reservations are needed. This is a walk-in clinic.
A lot of us are out of work and looking for something to do.
We have the machinery and the skills to make large scales of these masks and gowns.
Take care of your people. It's going to go way further than we actually can understand.
Right now, employees like myself are just adjusting to the new reality.
Reporting from Bronxnet, this is Trans.
Welcome back. A year into the pandemic, more and more people are faced with mental health stressors, and they need behavioral health support. A program at Montefiore here in the Bronx recently earned a national distinction for behavioral health for their continued work in addressing the mental struggles people face with life stressors, grief, and more. Joining us now to discuss is Dr. Jason Herrick, Interim Director of the Adult Behavioral Health Integration Program at Montefiore Medical Group. Welcome, Doctor. Thank you so much for joining us today.
Thank you for having me.
Of course. To start, can you please tell us about Montefiore's Adult Behavioral Health Integration Program, or BHIP?
So simply the BHIP service is a network of mental health clinicians that are embedded in Montefiore Medical Group's primary care practices. The teams that are in each of the sites are meant to provide mental health treatment in the primary care setting, and the reason is that provides timely access to care that we all know nationally and certainly in the Bronx is in short supply. And the fact that we are treating both physical and mental health problems in tandem, this is also a good thing because the data has shown that there's better outcomes on both fronts, both with the medical conditions as well as with the mental health conditions. And that just additionally highlights how the medical group is working to approach total wellness of our patient population. The program really does a great job of destigmatizing mental health. You're going to your primary care doctor to get treatment for medical and health conditions, and it sort of brings in the mental health component to that. And it really focuses on addressing the total wellness of our patient population in the communities that we serve.
Wonderful. Thank you so much, Dr. Herrick. And what exactly is integrated behavioral health? And how has BHIP continued to provide resources and services to Bronx families, especially during this pandemic?
There's a lot of different types of integrated programs. Integrated behavioral health is like I said, it's a network of mental health clinicians that are embedded within the clinics that share medical records, that have meetings and interact with the medical providers at our primary care sites on a daily basis. So it's a way that we can, share the responsibilities of treating the patients in our communities that need our services. And mobilize that relationship that primary care doctors tend to have with their patients, which is a strong, long, ongoing, sometimes even lifelong relationship that they have. What we do is we accept referrals from PCPs, from primary care physicians who have been identified as at-risk patients. These are identified in a variety of ways. There's a variety of universal screening protocols that we have, which will screen for depression, anxiety, substance use. They will screen for ACEs, which is a scale for adverse childhood experiences, which has been shown to when you have more of those, you have a higher risk for medical and mental health conditions. A patient can also come in and just request help and ask to be seen by one of our team members. Or there's sometimes just clinical impression that the medical provider or anyone in the clinic may have. It could be a nurse, it could be a front desk staff that says, oh, maybe you might want to talk to someone on our team that is here in the site. As you mentioned or referred to, COVID-19 has certainly required us, like everyone else in the community and really the world, to change the way that we do what we do. Historically, we did a lot of face-to-face work, a lot of the sort of what we call the warm handoff, where our PCP would identify an issue and then walk to our office with the patient, or would come find us, and then we'd go to the patient to the exam room and introduce ourselves. And there's a lot of data that shows that increases engagement, and they're more likely to come to the visits and follow up with the mental health intervention. Obviously, we've had to modify that. And because for social distancing purposes and to ensure the safety of our team as well as the patients that we're serving. And the way that we've done that is the medical group and our team has implemented telemedicine services that allowed us to really disrupt the care. Certainly, in the beginning there was some difficulties, but we were able to sort of limit disruptions of care as we kind of went through that initial surge last spring. The connecting with patients remotely, certainly there was a learning curve, and a lot of our clinicians had to retrain ourselves to deliver the services that we are really skilled at delivering in a different modality, kind of losing a sense, so to speak. You're not in the room with them. And our ability to connect with them remotely did serve that acute need during the initial surge, and later when there was a second surge and a second wave. We've also seen during that period of time that the remote service has been associated with improved show rates. So our patients are actually coming to and keeping more appointments. And I think We believe that, that this is really amenable to the patients that we support. There's a lot of barriers that are in place that makes follow-up, particularly for mental health services, challenging. So while there's still certainly some barriers that we need to address, and those things we've probably heard about, access to a reliable broadband, familiar with technological platforms. Right. For some, we do see it as sort of the future of how we're going to ensure the optimal mental health care to our community moving forward, which really is good to be able to think about and to see how we can take this negative experience and move forward with it in a positive way that can address the needs of our patients in a more timely and effective way and more patient-friendly way as well.
Thank you for that, Doctor. And speaking of the pandemic and, future research or future developments when it comes to the COVID-19 pandemic, early research by McKinsey and Company predicts that nearly 35 million people nationwide will develop a new behavioral health condition. What are some of the contributing factors to this rise?
Clearly, it's multifactorial, but there are certainly common themes that would contribute to the rise in mental health conditions that we're seeing. If you kind of put them into various baskets, there's the fact that people have been isolated, and isolation is certainly difficult for a lot of people. We are, humans are social beings at nature. A vast majority of us are. And to not be able to connect with people or interact with people in the way that we typically are accustomed to, whether it's friends or family members, that certainly contributes to a level of withdrawal and depression. We've had a sustained change in our routines, and to some extent we are creatures of habit. We do things in a sort of habitual sort of way, and when we have change in our routines and we don't really know when we're going to get back to our previous routine, or are we ever going to get back to our previous routine, you do see an increase in that unknown. And if you think about conditions such as anxiety, a large umbrella of a variety of conditions, a part of what's predicated on that is I don't know what's going to happen. I can't predict what's going to happen. When we have some of our routines historically, we have some sense of, we could anticipate what the future may hold with a greater level of confidence than we certainly do now. Obviously, we've never been able to predict the future, but it's certainly more difficult to do over the past year. It's been very much discussed in the media and certainly amongst the groups of people, but the pandemic itself has exacerbated a lot of psychosocial stressors. So, people losing jobs, people, losing loved ones, people not being able to, losing their housing. So those types of psychosocial stressors are things that certainly contribute to increase in mental health conditions. And, I would also add that we've seen an increase, and this is also something that's been talked about and discussed widely, is that we've resorted, as a population, we've resorted to a fair number of maladaptive coping mechanisms, such as substance use, whether it's increase in marijuana use, increase in tobacco use, increase in alcohol use. And those things may in the short term feel like it is allowing you to escape and cope and sort of and manage the pandemic and some of the thoughts and feelings that you've been having during the various quarantine situations or other sorts of stressors that have been going on. What people don't always realize is that substance use can contribute to mental illness, even though initially it might be seen as a coping mechanism, which is why we call it a maladaptive coping mechanism. And then I did mention grief a minute ago in terms of things that we've experienced. Grief can be thought of as on a personal level, like the grieving for the loss of loved ones, and Americans have lost more loved ones during the COVID pandemic than they have during a majority of the wars that we've been involved in combined. But it's also the grief for a loss of who we were as a people, who we were as a community. Things like going to a concert or going to a baseball game, or for kids going to school. I joke around with my kids that a silver lining is to be my kids really want to go to school now. But there's this loss, just being able to connect with people. And so it's beyond just, I think, the physical loss. It's just a loss of what was. And I think that's also something that certainly contributes to an increase in the mental health conditions that are being predicted.
Absolutely. Thank you for breaking that down, doctor. And I feel like we all collectively feel some sort of, disrupt, of course, with the pandemic. And maybe some of us are also not diagnosing or treating those conditions. Can you also talk about, if somebody's watching right now, if there's someone they know is depressed or anxious, what are some of the symptoms that they should look out for?
There's certainly the diagnostic symptoms that you could look out for, but no one's expecting any person to be a clinician themselves to make these diagnoses. I think what you want to be looking for is like a change. And there you see the signs of the depression right there, is that you want to be looking for a change in sort of what their baseline behavior was. And if you think of like one of the hallmarks signs of someone who has depression is like withdrawal. And it's withdrawal from a lot of things. It could be withdrawal from activities that they previously enjoyed, that they just don't have that level of enjoyment. We call that anhedonia, and they just stop participating in them. They don't have that drive or passion to engage in those activities. But if you think of it as just like a general withdrawal from life to some extent, they're the people that are having a hard time getting out of bed or want to just sort of stay by themselves, and they socially isolate themselves even when they don't necessarily need to for quarantine purposes. Avoidance, when people start avoiding certain things, again, it could be activities that they typically enjoyed. It could be doing things that are considered relatively safe now, but they're still avoiding doing certain activities. That could be an indicator that there's a level of anxiety. And avoidance is the hallmark of anxiety, and it is strongly reinforced when we avoid doing something that causes us to feel anxious. We feel, oh, that feels much better, so I don't do that anymore. So that might be indicative of some problem as well. I did sort of allude to substance use. So substance use is commonly thought of as a coping mechanism for perhaps self-medicating of mental health conditions or other conditions as well. So that should also be something that could be considered a red flag. But if you notice a loved one or someone who is drinking more or using other substances with more frequency, that might be something, an indicator that there's something going on and that there might be time to seek help. Ultimately, we want people to know, in one of our program of access to care, is we want people to know that they should seek help, and there is help that is available to them. What we see all too often is people wait to the last minute to seek help, and one of the benefits of being in a primary care center and having these services delivered there is that primary care is a preventative specialty. So we want to sort of bring and have the mental health clinicians in a primary care setting where you don't need to wait. If you or a loved one is having any issues, ask your doctors about feeling sad, worried, or whatever it is that might be going on. And the team of doctors, PCPs at the Montefiore Medical Group are certainly trained and skilled, and we have screening protocols that will help identify these problems and then be able to offer you the care the care that you need. And if we can't offer that care, we can hold your hand or bridge you until we get you hooked into the services that we think would be best suited for you.
Thank you so much, Dr. Herrick, for your time today. I wish we had more time, but we've learned so much with you in this segment. So thank you again. Before we go, how can people find out about Montefiore's behavioral health integration program?
The best way to probably get to learn about the program itself would be go to the website, the Montefiore Medical Group website, which is www.montefiore.org /BHIP. And the medical group is the same, www.montefiore.org /MMG. You can also find us on Twitter, Instagram, and Facebook. And as we do certain things, we certainly post and update the social media. That seems to be where more people get their information these days, increasingly so. So anything that we're doing, whether there's certain programs or groups or anything like that, those are places where you could find those things coming up.
And we welcome you back here on Open Tuesday, Dr. Herrick. Thank you so much. Whenever you want to come back.
All right. Great to meet you. Thank you.
Nice to meet you as well. Dr. Jason Herrick is the Interim Director of the Adult Behavioral Health Integration Program at Montefiore Medical Group. Open Tuesday will be right back.
those most at risk for coronavirus: people over 65, people with underlying medical conditions like heart disease, chronic lung disease, asthma, diabetes, people undergoing cancer treatment, and people with weakened immune systems. What should you do if you or a loved one is at higher risk? Avoid close contact with people, avoid crowds, stay home if you can, wash your hands frequently. Learn more ways to protect yourself and others at coronavirus.gov.
Welcome back. Upholding their mission to inspire lifelong learning, advance knowledge, and strengthen our communities, the New York Public Library at Wakefield continues to hold online events providing resources to the Bronx community. Joining us now to share more about their upcoming Summer Youth Employment Program information session and more are Shantay, Allbright, Branch Manager, and Whitney Davidson-Rhodes, Young Adult and Senior Librarian at Wakefield Library. Welcome. Thank you so much for joining us today.
Thank you so much for having us.
Thank you.
Of course. So we are a year into the pandemic. I'm curious about the current state of the New York Public Libraries. Is Wakefield open right now?
So currently Wakefield Library is still temporarily closed. We're not part of the grab and go phase, but we still offer virtual programming and still have, we are engaging with the community online.
Right. So neither one of you are at Wakefield right now, probably missing the community a year into the pandemic, right? Are you at different branches right now?
I'm currently at the Westchester Square branch, in the Westchester Square Tremont neighborhood.
Got you. And Shantay's at a different branch, I'm supposing.
Yeah, so I'm currently at the Baychester branch in Co-op City.
All right. It's still in the Bronx, so we're all good. But I'm curious to learn also, how has the New York Public Library at Wakefield continued to engage with the community online and through your virtual events?
So currently we heavily use our social media pages where we promote our virtual programming. Also, we stay connected with the schools. So we do virtual outreach. So basically that's providing book information, virtual resources, and etc. Also, we connect with the Community Board 12. We attend monthly meetings so we can engage with the community and promote our programs.
Right. And one of your many wonderful upcoming events is actually an information session on the Summer Youth Employment Program, the SYEP. Can you tell us more about this event?
So the Summer Youth Employment Program session that we're having was an idea brought together with different YA librarians in the Bronx. We kind of wanted to just have a general information session just to kind of give working age teens, so ages 14 to 24, just a general information on how the process works. The flyer was created by the YA librarian at the Hunts Point location. And we're just going to talk about the application process, what different service tracks you can apply for, and just general information just to make the program just to make the application process more smoother transition and less of a monster.
No, absolutely. No, thank you for hosting this information session and so many other information sessions that I've seen on the NYPL website. You have so many things going on for each and everybody to just join in, and it's completely free, right? It's the NYPL.
Yep, 100% free. You do need to have to register online since they're virtual. We do the majority of our programs through Google Meet, some specialized programs through Zoom, but it's free for everyone. Everyone has access to it. And if you don't have like a webcam, you can also dial into the programs as well.
Got you. And something else that I wanted to ask, in case a family member or a student is listening right now, the youth wondering about the SYEP, who qualifies to apply this year and what are some of the requirements?
So you have to be working age. You have to have the ability to work within the 5 boroughs. So that's the Bronx, Manhattan, Queens, Staten Island, and Brooklyn. You have to be between the ages of 14 to 24. And it's really just dependent upon what you're interested in. There is a general application, but there are also specialized applications, and it's dependent on your age group. You will need a working permit and an ID, and you will need some will need a access to the internet, depending on if the program or the SYEP opportunity is online or hybrid, and you will need a firm grasp on the English language.
Got it. And Whitney, there's also an application deadline, right? When is that deadline?
The deadline is April 23rd, 2021. So get your applications in.
Thank you so much for that information. And if you want to know more, of course, join the information session, which is taking place tomorrow, April 14th, at, online. So we have the information here on the screen, and you can find out more by following the NYPL Wakefield branch at NYPL Wakefield on social media. As a side note, I was also very excited to find out recently that we can finally apply for a public library card online for the first time. Can you tell us more about this and how people can apply at home?
So how people could apply for a library card online, they could go through our Simply E app, which you could download from your Android or Apple phones. Also, you could go to the website nypl.org. You could click on Get a Library Card, and there should be a link in the top right of the page. Also, anyone under 13, yes. Are you using the app?
Yes, I actually am. I'm using the Simply E app, so I just wanted to demonstrate it to our viewers. It's like it provides a catalog. There's a book club that you can join, poetry month. You have everything you need from the NYPL Simply E app, and it's completely free again. So thank you for sharing that, Shantay.
And also, anybody under 13, of course, they will have to have a parent or guardian help them sign up for the card.
Right. So I just showed a little bit of a snippet of what the Simply app looks like, but can you tell us what you can access using your library card online?
So you can access ebooks, audiobooks, research database with your library card. With the new NYPL app, which was launched a couple of months ago, you can do self-checkout as well. So if you go in the branch and you want to pick up your holds, you can actually go to the shelf and check out your books from the app itself.
Got it.
Which is pretty cool.
That is cool.
And then if you feel comfortable getting a physical library card, you could go into the branch.
Got it. And Shantay and Whitney, I know you mentioned that Wakefield is actually not participating in the grab and go. You're closed still. But what exactly is the grab and go, and how does it work?
So our grab and go is actually you come into the branch, you visit any of the 53 branches that's participating in the grab and go. You go in to return your books and to pick up books that you have put on reserve. That's on hold for you. So right now, those are the only 2 services that's available. We have no browsing, no computer services at this time. But that's basically it for grab and go. Hopefully in the next couple of months, we'll be able to expand our services, but at the time, we just have those 2 services available.
We also have a service called Shelf Help. It's basically you can call or go online and fill out an application. And what happens is library staff will pick 5 random titles based on what you like to read, whether it's fantasy, romance, science fiction, and then we'll put those books aside for you, and then you can come pick them up. So it's kind of like a recommendation readers randomized option for patrons if they're not sure what to read, and since they can't browse, we just pick random books for them, and it seems to be going quite well. We launched it, I want to say, September of last year.
Wow, shelf help. That sounds amazing. So you just gave us the key. It's on the website. We can also call to find out more. Before we go, I also wanted to just share, the importance of staying connected with your public library. I know that a lot of folks are a little confused about, the fact that their library branch may be closed and they don't know how to access it. Just tell us a little bit about the importance of staying connected and reading during these times.
Even though we're closed, like, we're still here for the community. It's just important that people know that we're here and that we're still here for you, even though Wakefield itself is closed. We are partnering. This pandemic has taught us to partner with other organizations, with other branches that are open, just to make sure that we get that information to you, to make sure that you have access to regardless. The whole point of the library is access, like free access. And even though Wakefield is temporarily closed, there are other avenues in which you can. We miss our community, and we just wanted to let them know that, we have this information. Follow us on all of our social media pages, because even though we're not physically open, we're still here for you. So any and all updates about Wakefield and NYPL in general, follow us on NYPL Wakefield on IG and Twitter.
Thank you so much. And I'm sure the community misses you as well. Hopefully we'll be back soon and in person after the next phase comes up. Before we go, can you please invite our viewers to register for the upcoming information session and your future events?
Yes. So register online at bit.ly/info, SYEP, capital S, capital Y, capital E, capital P. They must be capitalized. For our next session on Wednesday, the 14th at 4 p.m. And stay tuned for Virtual Bronx Anti-Prom 2021. Going to kick off this year in June, and we're going to party all summer. And again, follow us on social media, NYPL Wakefield for IG and Twitter.
Thank you so much, Whitney Davidson-Rhodes, young adult senior librarian at Wakefield Library, and Shantay, Allbright branch manager at Wakefield Library. Thank you for joining us.
Thank you for having us.
Of course. We're taking a quick break. We'll be right back here on Open Tuesday. Welcome back. For the last 31 years, St. Anne's Corner of Harm Reduction has continued to provide community outreach and services here in the Bronx, and the pandemic hasn't stopped their work. Here to discuss the impact COVID has had on harm reduction and more is Krystal Montalvo, co-director of programming at St. Anne's Corner of Harm Reduction. Welcome, Krystal. Thank you so much for joining us.
Thank you for having me.
Of course. So to start off, can you tell us about St. Anne's Corner of Harm Reduction and your mission?
So St. Anne's Corner of Harm Reduction, as you mentioned, has been around for 31 years, and we actually started 31 years ago on the outside of the corner of St. Anne's Avenue and 139th Street, and it's now a community garden, and that's where our CEO, Joyce Rivera, started doing syringe exchange through the trunk of her car. And from then up until now, we've been providing a large array of harm reduction services through a holistic approach in the streets, at our street sites, at various sites in the Bronx, New York, and at our central office that is currently at 886 Westchester Avenue.
Thank you, Krystal. And as I mentioned in the intro, your work hasn't stopped during the pandemic. We're a year into the COVID-19 pandemic, and you continue to do outreach and services. Can you tell us how SACHR has continued to provide harm reduction during COVID-19?
So COVID-19 actually challenged us to think outside the box in the way that we provide traditional harm reduction services, where we used to provide an array of our services at our central office and then solely just provide our syringe exchange in a small portion, a small menu of services on our outreach sites. We now shifted to providing a full range of services at our outreach site to mitigate the transmission of COVID-19. And we wanted to ensure that we were giving our staff the health and safety that they needed to be safe. And we also wanted to remain as a pillar in the lives of our participants because they don't have access to a lot of the resources that we provide them, like warm meals, like our syringe access services, like our hygiene kits, and anything that they need, even up to clothes donations, we try to provide for them at our central office, but now 5 days a week at various outreach sites.
And when we talk about the opioid crisis in the Bronx, Krystal, it's something that has been long, held here, an issue in the community. And your work, of course, continues to help people with an empathetic lens. How has the pandemic impacted the opioid crisis in the Bronx? Has it gotten worse? Is it still the same?
It has gotten, we have received a large amount of fatal and non-fatal reports of overdoses, and for our naloxone distribution numbers, we have increased because of that. We are giving out about 150 naloxone kits a month, and that is to reduce opiate overdoses. And with that, we are providing fentanyl test strips with our grab-and-go bags to try to reduce non-fatal and fatal overdoses.
And I'm glad you brought up naloxone. Can you tell us more about your Narcan training offered at the center? And what is naloxone exactly, and why is it important for everyone to learn how to administer it?
Naloxone is a opiate reversal spray that is now sprayed in the nose. And what it does is it blocks the receptors in the brain that is triggered by opiates. So it will block the receptors in the brain when you're overdosing. And what happens a lot of times, more than usual, is that the individual then go into a system of withdrawal. They're being blocked. The opiates that they took are being blocked so they would come back. Our naloxone program, we do provide trainings now via Zoom, and we do provide trainings in the community. The Zoom trainings, we do kind of minimize them to 50 people. If we have to transport the naloxone to the organization or the individual, we would do that. But in the community, you can just come up to any of our staff and they can access a naloxone kit.
Got you. Thank you for sharing, Krystal. And if somebody's listening from an organization or an individual, how can they get in touch to find out about that training or inquire more?
They can send me an email directly and I can coordinate a training with them with one of our staff members, whether it be myself or one of our outreach coordinators.
Can you provide your email real quick, Krystal?
Yes, my email is KMONTAL V as in Victor O at SACHR.org.
Thank you so much for that. Something else that the team does is a syringe outreach response. Can you tell us more about the SORT team and what it entails?
Our syringe outreach response team is it's made up of our participants, and the idea is for our participants to give back to their community, and while also accessing some job training. So it is it's a program for our participants to acquire jobs and to go into the community and pick up syringes in areas where either we find high risk substance use or where it's reported to us, and then we go out and pick up the syringes wherever we need to 5 days a week.
Yeah. I actually met you at one of those events, one of those cleanup events over at St. Mary's Park. It was, can you tell me a little bit about that story? Like the school reached out to the team and asked for help?
So the school is on our cleanup schedule already, but as I said, we do have a lot of sites that we do visit. So we go there once a week. So they did reach out to us again, and they wanted to do a cleanup because the principal wanted to bring the children out to the playground since they didn't have access to their playground. So we went out and we met up with another organization, which is actually New York Harm Reduction Educators, and we did a small little cleanup around the surrounding areas of the playground so that she can feel safe to bring the children out there.
I learned about some of the disposal areas too in the parks. Like I didn't know that there were different disposal boxes where people can throw out the syringes safely, and that's also part of the education and outreach at the organization, right?
Yeah. So the kiosks are in several parks throughout the Bronx and Washington Heights, and those kiosks are accessed by New York Harm Reduction Educators to empty them out. You can, if you wanted to, you can get a kiosk. If you have a private property, you can set one up yourself. But they are a safe space for participants or those who are using substance to dispose of their syringes. And we are finding that they are using them. So it's just like any other, when you see a mailbox on the corner, you see a kiosk or your syringes in there, and they'll be picked up and safely disposed of.
Gotcha. Something else I wanted to ask, Krystal, is where do you normally set up outreach tents, and what dates and times are you out there?
Tuesdays, we are at our home site that I like to call it, at the corner of 139th Street and St. Anne's Avenue from 10 a.m. to 2 p.m. Fridays, we are at the corner of 148th and Bergen. It's near the Hub and 3rd Avenue. We're there from 11:30 to 2:30 p.m. And Fridays, we're back at our home site at 139th and St. Anne's Avenue from 3:30 p.m. to 6:30 p.m. And there, individuals can get syringe access, naloxone kits, warm meals. They can get access to confidential testing. They can get access to case management services and referrals to any service coordination that they may need.
And that's no questions asked, as anyone who needs the services will receive them, right?
Yes, it's one who needs the services. So our syringe access program is for those who use syringes. They would need to qualify for the program, but we also have a high-risk women's program for any woman who is engaging in high-risk behaviors or feels that they are in danger because of a domestic violence situation. But also our testing is for community members. So anyone up in the who is in the street and wants to get a confidential test can approach our van and get one at the site.
Good to know. Something else that the St. Anne's Corner of Harm Reduction does is a sanctuary. It's called The Sanctuary. What is it exactly, and how has it helped people heal and rest?
So a part of harm reduction, we have a holistic approach. So we try to find ways to reduce harm from substance use, however that may be. So acupuncture, auricular acupuncture, is actually used for withdrawal symptoms. So that is what the sanctuary is. It's also a safe space for our participants to come and relax and choose. They're in the streets 24/7, and St. Anne's is their home and it's their safe space, and they can come in the sanctuary and get a massage, and they can get warm hot stones on their back that we used to provide. We have a licensed acupuncturist and a part-time acupuncturist at any given time. And it's just a safe space for them, and they really love it. I was actually one that engaged in acupuncture while I was pregnant, and it's amazing.
And is it still open, Krystal, during the pandemic? Can people still access the sanctuary? Like, is it by appointment, or how does it work?
At this moment, we're currently looking for a new licensed acupuncturist, but when we do find that person, it will be by appointment, just so we can reduce exposures and we can keep track of how many people we have in the space at a time.
Gotcha. And another question I wanted to ask is, why is it important for the organization to approach this work from an empathetic lens? Just talk a little bit about, using empathy when it comes to harm reduction.
So substance use is a public health concern. And just like any other public health concern, it is something that we would want to approach someone if it were us, if it were our mother, our cousins, our sister, our brothers, how would we want to be approached? It is something that should be treated. The war on drugs, I can go on, and I know I have a short period of time. The war on drugs is very punitive, and it doesn't show that any outcomes. So right now we're trying to show people that you can be a substance user. You can still be someone who has empathy yourself.
Right. Well said. Thank you, Krystal. And any programs that we missed that you want to shout out and tell us a little bit more about?
So I do not talk about our Ryan White program, which is for individuals living with HIV. We do get them access to case management and care coordination. We do have our peer-delivered syringe exchange peers who go out in the community and bring out syringes to participants who may need them and may not be able to come to the office or the outreach sites. We do, again, have our women's services unit, and we do provide MAT services. And that scope of MAT is specifically Suboxone or buprenorphine, and we provide that here through telehealth.
Got it. Thank you so much, Krystal, for your time. Before we go, just let us know how people can reach out for support, for the cleanups, and more.
Okay. So just reach out to me through my email, or you can contact us through Instagram. Our social media consultant will let us know when we have someone who's interested in services, or check out more of our services on our website.
Thank you so much again, Krystal, for your time.
No problem. Thank you.
Krystal A. Montalvo is the co-director of programming at Canaan's Corner of Harm Reduction. That's all for our show today. I'm your host, Sonyi Lopez, wishing you and your family safety and wellness now and always. Take care.